The House Health Policy will come to order, so glad Representative Filler could join us today. Would the clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett. Carter. Here. Hadsma.
Present.
Neely. Here. Glanville.
Present.
Kafia.
Here.
Conlon. Here. Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Rangens.
Present.
Vanderwall.
Present.
Mueller. Or Filler, sorry.
Yes.
Mueller.
Here.
Van Werkum.
Yep.
Roth.
Here.
Schmaltz.
Here.
Thompson.
Here.
Madam Chair, you have 18 members present. You do have a quorum.
Thank you. I think the minority vice chair's blinding jacket blinded the clerk, and she did not see Representative Filler, but we'll allow it. Representative Rangens moves to approve the minutes from our meeting on November 9th, 2023. Seeing no objection, minutes are approved. Today we will hear testimony on House Bills 5368, 5369, and 4532. We have substitutes to adopt prior to testimony that address conflicts as introduced and incorporates feedback from stakeholders. Testimony today will be directed towards those substitutes being adopted and not the bills as introduced. First, we will take up House Bills 5368 and 5369, where we will adopt the substitutes before us and hear from myself, Dr. Cheryl Dixon, a pediatrician from Western Michigan University Homer Stryker MD School of Medicine, Jane Nickert, nursing director of the Washtenaw County Health Department, and finally, Tanisha Henry, chairperson for Detroit-led Parent Advocacy, DLED. First, we will adopt the H1 substitute to HB 5368. Representative Conlon moves to adopt the H1 sub to HB 5368. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett. Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Rangens.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Werkum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
Moving on to HB 5369, Representative Glanville moves to adopt the H1 substitute to HB 5369. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett. Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Rangens.
Yes.
Vanderwall.
Yes.
Filler.
Yeah.
Filler. Sorry.
We were just messing you guys up
You
today.
were. Mueller.
Yes.
Van Werkum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
Next, we will proceed to House Bill 4532 by adopting the H2 substitute on HB 4532. Representative Fitzgerald moves to adopt the H2 substitute to HB 4532. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett. Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Rangens.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Werkum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 18 yeas, 0 nays, and 0 pass. The substitute is adopted.
Committee will stand at ease, call of the chair.
The committee will come to order. Chair Rogers, please begin when you are ready.
Good morning, and thank you to the committee for your attention to this important topic as we continue the work we started last year on the topic of lead and lead exposure. Preventing lead poisoning and ensuring those affected get the care they need has been a priority of mine for many years, and I am delighted to be testifying here today. Michigan has tragically been the center of lead poisoning in national headlines because of high-profile lead-related tragedies in many of our communities. In addition to those high-profile tragedies, lesser known and less publicized cases of lead poisoning are taking place in each one of our districts. As a practicing physical therapist, I have firsthand knowledge of the dangers that lead exposure can lead to. One of my patients experienced severe balance issues that progressively worsened despite our best attempts to rehab and treat their symptoms. It wasn't until a heavy metal blood panel test came back positive for lead that we realized that my patient was experiencing exposure and side effects to lead poisoning. We eventually learned that this tragedy was from a coffee mug he drank out of every morning that had been painted with lead-based paint. This is just one example, but it highlights that lead exposure can happen in many ways, not just in drinking water and lead pipes. Lead is a very difficult substance to detect because it has no odor and you cannot see it. A significant source is lead paint in homes built before 1978, and I thank Representative Hood for her work on HB 4532 to address the remediation efforts to prevent further lead exposure and poisoning. While HB 4532 will take significant steps to prevent future exposures, we currently have individuals throughout the state facing serious health effects from lead poisoning. While there is no level of lead which can be considered safe, a standard for the detectable level of lead in the blood is necessary to initiate medical treatment. This measurement, known as the blood lead reference value, has been set in Michigan statute at 10 micrograms per deciliter for many years. Science, however, has advanced in recent years, and medical professionals have recognized that an even lower level of lead detected in blood requires medical intervention. The CDC adopted the Federal Lead Exposure and Prevention Advisory Committee's recommendation that the lead level be lowered to 3.5 micrograms per deciliter on October 28, 2021. My bill, House Bill 5368, would bring Michigan in line with the new blood lead reference value by adopting the 3.5 microgram per deciliter standard while providing the opportunity to use a lower level if science determines a lower level is appropriate in the future. The bill defines elevated blood lead level as 3.5 micrograms per deciliter, again, a level set by the Center for Disease Control and Prevention, or a level set by Michigan Department of Health and Human Services, whichever value is lowest. This way, we will not need to adopt additional legislation to ensure that Michigan remains at the forefront of medical science when determining who needs treatment and services because of lead poisoning. Thankfully, MDHHS has been very proactive in taking action that has adopted policy utilizing the 3.5 microgram level on May 1st of 2022. However, this is only their current policy, and nothing in our current statute ensures patient access to services without adopting this bill. Unfortunately, even after diagnosis and a determination of an elevated blood lead level, residents can slip through the cracks in receiving vital services and early interventions. Representative Whitsett's bill, House Bill 5369, would require an automatic referral to the Early On program for every child who has elevated blood lead levels. Families who participate in Early On receive additional resources and support to deal with the consequences of early childhood lead poisoning. For background, the Early On program is part of Michigan's comprehensive early childhood system of services. Early On serves infants and toddlers from birth to 3 years of age with developmental delays or conditions that could lead to such a delay. Exposure to lead can seriously harm a child's health, including some of the following: damage to the brain and nervous system, slowed growth and development, learning and behavioral problems, hearing and speech problems, anemia, seizures, and sometimes coma. The longer a person is exposed to lead, the higher the likelihood that health problems could occur and the effects may be longer lasting. House Bill 5369 is crucial to ensuring that Michigan's children are connected with the resources they need as soon as possible after lead exposure. Again, thank you for your attention to this critical legislation, and we ask for your support on this package.
The committee will stand at ease at the call of the chair.
I think we're going to take questions after this section of testimony on these first two bills, and then if you can wait just one moment. Next, we will hear from Dr. Cheryl Dixon, a pediatrician joining us remotely from Western Michigan University Homer Stryker MD School of Medicine, who can provide a perspective on the dangers of lead for children and why early and aggressive intervention is so important. Dr. Dixon, welcome to the Health Policy Committee, and please begin when you are ready.
Thank you so much for this invitation, and thank you, members of the committee. It's my honor and privilege to be here on the invitation of Representative Julie Rogers. As a pediatrician, I echo what Representative Julie Rogers just said about witnessing firsthand persons, particularly kids, who have lead exposure. Unfortunately, I've actually seen children who've had high lead exposure who were not detected early enough, who presented with seizures, encephalopathy, and I've even seen death, unfortunately, for something that is preventable. I do want to echo what Representative Rogers already said, that ideally, a blood level should be 0. Actually, none of us should really have lead in our blood at all, but the United States actually has said for a reference level that less than 1 microgram per deciliter is the reference level collected from data looking at children from the ages of 1 to 5. I also want to emphasize that once the damage has occurred to the neurons, it's irreversible. And that actually is really important to know about and understand why these bills are so important for primary prevention. The damage is irreversible, meaning that particularly children less than the age of 36 months who are actually more vulnerable because they are developing neurons, their brain is in the process of collecting information and growing, lead attaches to their developing neurons. And actually later on is when we start seeing some of those manifestations, unfortunately, that were already mentioned, but I'll talk about a little bit more, which are the developmental delays, inattention in school, hyperactivity, and things that actually impact negatively their academic success and future. The CDC, recommended the level be reduced to 3.5 micrograms per deciliter. And that was in conjunction with the NAMES, which is the National Health and Nutrition Examination Survey that they do. That was done in 2017 to 2018. And I also just want to emphasize that it's a reference that's set by states, right? And the recognition to set it lower like this, to make sure that this is something that's mandated, is because we know that the levels is not going to be visible. There are not going to be any findings that I can pick up that a child may have with a level less than 3.5 or 3.5 and above. So that's why it's important to actually do the screenings, because we know that levels that low can actually have been reported to be associated with impact on neurological developmental progress for infants and children. So even those low levels, that's why it's so important to get to the 3.5. And they've even showed that even less than 3.5, I have to say, actually can be correlated with poor academic achievement. Nationally, there was a study done, I think in 2021, that showed that when they screened blood levels of children aged 8 to 15, that had blood level concentrations that were about this level or less, that they had elevated risk, was documented for ADD, or attention deficit and hyperactive disorder. The higher it went, the more likelihood that they would have more symptoms of ADHD. And we know that that actually impacts their ability to pay attention in school and their future academic success. Lead impacts all parts of the body. And the damage to the brain and the nervous system is probably the most that, worst that we can say because of how it attaches. But it also does slowed growth. So we see the we measure growth and development, and we see kids don't grow as well that are impacted by lead. They have learning behavior problems as well as hearing and speech. It's stored in their bones. And what can happen is later on, it can impact not just neurological, we said encephalopathy and seizures with really high levels, but it also impacts renal function and kidney function. Hand in hand with lead is also anemia. So iron is absorbed like lead. And so children or patients who actually have low iron or who are anemic actually will, when exposed to lead, have a higher likelihood of having toxicity or actually having impact of the lead. So lead will be more likely absorbed in children who are also anemic. We know that the higher likelihood are kids who are, again, I said the ages, and the reason is that they're closer to the ground. They have this behavior of taking their fingers and putting things in their mouth. So dust particles, which can actually contain a large amount of lead, and remember their surface area, right? So they're orally taking in this dust particles with this concentration that will, be large for them in their body. So again, peeling paint, window seals, dust on the floorboards, that's where they live. They're like on the floor or on the ground. The other thing is also even in construction. So construction that's not led by persons that are certified for lead abatement. And people do construction, right? What will happen is this dust. The dust that happens, more likely again that they will be exposed. Even if the other exposure are person, kids whose parents work in construction and they come home and they have the dust on their clothing. It's another occupational hazard for kids. And so it's really important that these bills that you're introducing in terms of also the making sure people are certified and how they do it when they're doing construction are done. Playgrounds, we also know there's higher risk for populations that live in urban and inner city areas because they're more likely to live in old houses that are disrepaired. Also more likely to have pipes that will probably have lead in them. So more likely to have the water source of lead, which again, children and infants, the water, if you're using the tap water and that actually has lead in it, to actually mix the formula, that's the other source. And we already know about what happened with that in Flint. And again, that's something that when we look at older homes and look at, what's happening, that's the other source. And again, particularly with construction, the soil seeps into the soil. Kids are outside playing. And if they're playing and they don't have green spaces and they don't have those built environments for play in some of these areas that are poor, they will actually be more likely to also be exposed in the dirt. Again, that finger to mouth behavior that actually will then make them actually have ingestion of more lead. So I think that important takeaway too is that not going to be readily apparent, right? It's not going to be readily apparent until it's really a higher level. And that's when it's too late. And that's the key, that, the not really having the visible signs. When we detect at 3.5, we need to make sure that there's no further intake of lead so that it gets higher and likelihood of actually causing more damage. Representative Rogers mentioned also the ceramic pots, that's the other, and persons, using sometimes holistic and traditional medications or things that may also have lead. I want to also say that the consequences of having lead, the lead is actually something, once you have it, unfortunately. And what happens is that the consequences also go into adulthood. So into adulthood, we can see problems with perinatal health. It's been linked to hypertension, which we see renal insufficiency and increased cardiovascular mortality. Adults are impacted by lead. Again, not so much in the brain, they have more peripheral neuropathy, but they also can have problems, GI problems, reproductive system problems, kidney problems, and blood pressure and cardiovascular problems. We routinely do testing at 12 and 24 months, less and more often if there's high risk. And again, those high risks, some of the things we mentioned, where they live, if the home has peeling paint, if another child has been tested and has high lead, we test them earlier, as soon as they're actually even crawling. So those are things that we take into consideration for actually, again, getting to our primary purpose, which is optimal, which is primary prevention is key. Lead, unfortunately, it is still, even though it was banned, is still a major source of what we see for paint. The other is that, just to close, is that I just want to emphasize that we have to think about lead as a lifetime exposure, even after the blood level declines. Because again, when we're watching children, you don't always see exactly what they're going to be. There are certain things that they do developmentally. I'm sure you all have kids, and you see as they, get older, there's other things that you expect, like they're talking, and they're, other things. They walk at a certain age, and other things that we expect them to happen. I think the key, one of the key proposals for Representative Rogers to put forward is then there's a connection. So when we find that level, first of all, making sure we're screening for that level that's less than 3.5 micrograms per deciliter, but the other is to make sure we refer them. Early on, services are something that can help with the resources for families. We can also optimize the development for those children that may have been impacted, help families with skill building. It's just all good. So I think that having that connection with the early screening is wonderful and key. I don't know what else I can say to actually support or have you to support these proposals by Representative Rogers. Thank you.
Thank you so much, Dr. Dixon, and I always enjoy having folks from Kalamazoo testify. We appreciate you. To speak to the experience of handling lead poisoning from the public health perspective, we have Jane Nickert, Nursing Director for Washtenaw County Health Department, joining us virtually. Thank you for joining us today, Ms. Nickert, and begin when you're ready.
Good morning, and thank you for the opportunity to be here today, and the work that all of you are doing to protect the children of Michigan. And thanks to Representative Rogers and Dr. Dixon for giving such a great intro and sort of the reason that we're all here today. So I have been a public health nurse my entire nursing career, so for 30 years. And in that 30 years, I have never strayed away from the issue of lead poisoning prevention in my roles at local health departments, both in suburban and in urban areas, the city of Detroit, which is one of the epicenters of lead, but also in my position previously at the state health department as one of the nurse consultants in the program. Lead is something I'm very passionate about, and I have never gotten away from. And even now in my role as director of nursing, I am still doing the home visits and the case management services for children who have elevated blood lead levels. So I'm here really today just to share my support, not only as a public health nurse, but also as a member of the board of the Michigan Council for Maternal and Child Health. And I believe that you received the packet from Ms. Zagman about the support that MCMCH has for these bills.
Yes, we did.
Like Dr. Dixon and Representative Rogers, there is no safe level of lead. It does follow a child through their lifetime. I think that we also never really know what's truly happened with a child with an elevated lead level, because when we do a lead test, it is a snapshot in time about some potential recent exposures, but not what is maybe happened several months before in terms of how high a lead level may have been. So we're always working in a little bit in the dark, if you will. So the idea of not having to change the law every time a level is lowered is something that surely I am in support of, because it just allows us to move forward with doing the work that we need to do to provide these children with all the supportive care and resources that they are entitled to. I also want to share that Early On is a favorite program of public health. We refer children to Early On all the time, and certainly in support of assuring that children receive these services that they are entitled to. And it is something that we have in our case management toolkit. And case management, for those that don't know, involves public health nurses going out and doing home visits to children that have elevated blood levels and doing enough number of assessments, including an environmental scan and hooking them up with appropriate resources for remediation, and providing other referrals that will help support the child in their lead poisoning journey. And I know journey kind of sounds like a like a positive thing, but it is for a lot of these families a long-term journey to deal with their child's elevated blood level and some of the effects of that blood level. And Early On is one of those things, one of those resources that we use very often. And as Dr. Dixon pointed out, it is and Representative Rogers, I apologize, Representative, it is a program for children birth to 3 years of age. I think the one thing that I would like to talk about is maybe a little bit of the shortcomings there, is that what we don't have is a good system for children between the ages of 3 and 5. If we don't find out about an elevated lead level until they're 3 years of age, which is a little, we want to know about them earlier rather than later, but we know our system here, we don't always find out about them early. We don't have a good mechanism necessarily for all children. If we have missed that window of 0 to 3 for Early On. And this does follow them into their academic career, where we know that very often what we start to see is some of the delays. Child may have been poisoned much earlier, but typically in kindergarten and first grade, when they're learning to read, we start to see some of the deficits. Again, at fourth grade, when they're reading to learn. And then again at sixth or seventh grade, when they're starting to do higher level functioning, is when we really start to see some of these behaviors and difficulties in the educational setting. So really wanted to just say support in support of the legislation that related to Early On, but would just also have you consider what we might be able to do moving forward for those children that are the ages of 3 to 5 and may not be enrolled in, which we use as well as in our referral bag, but early learning programs, Great Start Readiness programs, parent as teachers. We look for all the referrals, but having a system that guarantees support to these children would be my ideal of the next step that we would take. So thank you so much for your time and the opportunity to be here today.
Thank you, Jane. We appreciate your suggestions as well. With a personal experience of lead exposure and experience with other parents as the chairperson for DLED, we have Tanisha Henry also joining us virtually. Thank you for taking time to speak with us today, and begin when you're ready.
Good morning, everyone. How are you?
Good, thank you.
First off, I want to pay the bills. I want to say what I have to say, then I want to give you my experience. First of all, my name is Cynthia Henry. I am a co-chair for DLED in Detroit, Michigan. We work towards eliminating lead problems within Detroit, of course, but the great state of Michigan. I personally, my grandmother is a state representative in Mississippi, so I've actually been talking to her and sharing my knowledge with her as well. We support these 3 bills that are being considered today. I want to thank Representative Rogers, Hood, and Whitsett, which I've actually met all of you guys. So, hey, thanks, guys. Now that I've paid the bills, I want to tell you a little about the situation. I have a grandchild who was diagnosed with lead poisoning at the age of 4. His blood lead level at first diagnosis was 21, which everyone here knows that age 4 is late in the game. Very late in the game. I will tell you his name. His name is Lloyd. Lloyd is now 11 years old in 6th grade. Lloyd has extreme difficulties with math, reading, just comprehension. I thought he was dyslexic. He has so many problems. Yes, he does have an open IEP, but I'm going to be really, really honest. This late in the game, and even when he started to get help, which was to me was late in the game, we're striving, we're working hard every day, but at the end of the day, it's a struggle. He struggles on every level. He has a younger brother that is now 3. Of course, I'm very diligent about getting his lead levels tested. I think he tested as a 2.5, if I'm not mistaken, at his last appointment, which was 6 months ago. So it's time to do it again. But he is very hyper. Very, very, very hyper. Please, if you need an example, I got 2 kids. I'll bring them to you. I will bring them to you. But yeah, so with that being said, there is something else I need to discuss. The Early On program. I am a mother of a premature child. My oldest son was born at 1 pound, 11 ounces. I was 24 weeks. No one could explain why. My first child was 9 months on the nose. Great. All of the rest of my children were all premature. No one could explain that. The doctors couldn't explain it. Nothing. But I was blessed to have the Early On to help me with navigating my son's cerebral palsy. I understand cerebral palsy is not lead poisoning, but the help that you get from the Early On program can help in all the way around. That's just something that, I feel like you should know. And this is coming from someone that, again, has dealt with it. I am now in stage 3 renal failure. My doctor, I've never had high blood pressure until like 7 years ago. All of a sudden, my blood pressure was uncontrollable. My doctor, the way that he wants to check and see when my because my blood metals came back with the elevated lead content. The only way that they can really find out is if I lose my teeth, and these are perfect. These are mine. So, like I told him, he has to wait. He just can't pull them out. I need these. But yeah, these are things that are going on. This is an everyday thing for me. I live with this every day. I understand that not everyone has to go through this. I live in a 100-year-old house. My house is 100 years, period. I'm going to give you an example of some of the common sense things that don't go on. The house next door to me was being renovated over the summer. And I came home. They had a fan in the window and were sanding the floors. I don't know how much you guys really know about the RRP rule, but they were sanding the floors with the window open. And the dust from the sanding of the floors was just flying into my driveway. which my window on that side of the house is open, and there's an air conditioner on that side of the house. So therefore, they were contaminating my house. Of course, I went spamming on the door. Hey, stop what you're doing. Stop what you're doing. Who is in charge? So the guy comes out and he says, well, I'm in charge. I said, where's the owner? Do you know the RRP rules? I do. I'm certified. He looked at me and said, what is that? We need to crack down on that. Then the problem was getting someone over here to stop them. That was the next problem, because the red tape was unbelievable. I made 103 phone calls, 103 in 4 hours, to try to get someone over here to stop it. They were scraping the paint off the outside of the windows. If you know lead paint, it kind of looks like alligator skin. I'm telling them, hey, stop. What are you doing? You are contaminating my driveway. Again, they don't know the rules. They don't know that they're contaminating and could potentially be harming us. They don't care. I feel like it should be in-house in our state, that there's a universal department that we contact. I did finally get some city inspectors out here, and it pretty much, realistically, it ran them away. But what if I didn't know? What if I wasn't educated on the effects of lead paint and all of the ways that it spread? I came home and it was literally paint chips, like blowing. It was literally paint chips in my driveway. So once I get out my car, I walk that into my house, which in turn, again, I told you I have a 3-year-old. He's on the ground with toy cars and all of that all the time. These things are just dangerous. People don't know. Excuse me. People don't know. And the people that do know, it's a hard fight. I was raised that each one teach one. And my neighbors, I talk to my neighbors. I talk to, people in the community all the time. I pass out flyers and explain to them how serious it is, especially over here on the west side of Detroit, right there near Boston Edison district. All these houses are 100 years old. All this entire area, I've been on the news. I've expressed how serious this is for the kids. I feel like I may not see it in my lifetime, but I feel like if we make the moves to protect these children now, the next generation won't have to worry as much about it. I feel like our prisons are filled with people that had no idea that they were exposed to lead.
Ms. Henry,
Because
thank you so
realistically, I
much.
didn't know anything.
Thank you so much for testimony. We do have several other people we need to fit in. Do you want to wrap up with one last statement?
I just ask that you please take all of these bills under advisement and pass them all for the sake of our children.
Thank you. We really appreciate your time. Thank you for zooming in.
Thank you.
We're going to pause a second and take questions on HB 5368 and 5369. So I know I have Minority Vice Chair Vanderwall as well as Thompson. If you want to start out, Representative Vanderwall.
Thank you, Madam Chair, and again, thank you for the testimony. Just a couple questions. One pertaining to 5369 and the early on, and just wondering if the bill sponsor has any estimated cost to the state, how many new enrollees that would be to the system, and if once they're on the program, are they always on the program for the extent of their eligibility? Those are just a couple questions I have on that.
Thanks. We can look into that and get back with you. I will say that I think it's going to be difficult to determine exactly what this legislation would do, because we've also passed Senate Bill 31 and House Bill 4200 that came through our committee, and that was the Cherry Scott package, which is mandating the 1 and 2 year olds. So I anticipate that we're going to see a dramatic increase in the number of children that test positive, because we'll be increasing the number of tests. So I think it's going to be difficult to tease out, should this new legislation before us today pass, I think it's going to be difficult to tease out which bills did what, if you can imagine. But we will still look into your question and get back with you.
Yeah, I appreciate that. And then just the last one is, once they're on, even if their elevated lead levels go down, are they always going to remain on through the extent of their eligibility?
We will double check with the experts early on, but I'm pretty sure that they reduce the time frame lessons, but I'm pretty sure they're still on their caseload, and they do the time frame is longer as their levels go down. And then we have Representative Thompson.
Thank you, Madam Chair. My question is also directed towards House Bill 5369. Wanted to do some clarification with the Early On program. It states, and I've heard testimony today, that works with families of children at birth to 3 years. I appreciate the testimony that says we have a gap with kids that are being diagnosed at 4, 5, and 6. Now, if we're mandating that a pediatrician or a public health department refer a child to the Early On program, and for example, they are 5 or 6, will that referral be taken, and what will that look like?
So right now, my understanding is, as was in testimony, the Early On program is only up to age 3. I think some good points were made about potentially expanding. This bill does not do that, but I'd be open to looking into that possibility. We also have Representative Hadsma.
Thank you, Chair Rogers. This is a question for Ms. Nickert, if she's still on.
Jane, are you still on?
I am.
Wonderful. Representative Hadsma.
Ms. Nickert, in context of what Representative Thompson just asked and Representative Rogers just answered, you at the conclusion of your testimony indicated the importance of having this broadened, that this only goes 0 to 3 presently by the substitute to 5369. What might we do to broaden this so that we have people like Ms. Henry's 4-year-old grandson involved, and people like Ms. Rogers, Representative Rogers' patient who drank from a lead painted cup involved?
So I will say that I would refer to some of the experts at Michigan Department of Education and the Early On program. And I don't know if it would necessarily be an expansion of the Early On program, or if we have another system. I mean, maybe it's easier to expand the Early On program, or at least assure that we have another system, because while we do have some systems in place with Great Start Readiness programs, Head Start and Early Head Start, they're not necessarily as individualized in terms of the necessary therapies and things that Early On can provide. So I'm not sure I have an answer for how that would look. And maybe like I said, the simplest thing would be to do is to expand the Early On program so that those supportive services continue, at least until they get into the school system. An IEP can be developed, and they can start to focus on the educational pieces at very specific to that early education, and then on to their more senior education.
Thank you.
Representative Van Workum.
Thank you, Madam Chair. My question is regarding 5368. My understanding of these bills was to bring it more in line with the EPA standards and CDC standards. But with the substitute and from the testimony, it seems like there's going to be basically an avenue not to do the 3.5, but from the testimony that has been provided, they're saying there's no safe level of lead. Is the goal here to actually get to that standard, or is the goal to get to 0?
So I think that there's been, quite a bit of research with correlations. It's difficult to have causation, but I think there's correlations that was testified, and the science is showing right now that the absolute maximum for needing a referral is that 3.5 threshold. So what the experts are saying is there is no safe level, you're correct, but the recommendation by the scientists that look at this and look at the correlations for symptoms is that that's the 3.5 threshold.
But the legislation provided, or the substitute today, could allow the DHHS to put it at 0.
There is, in the legislation, it says that whichever is lower, the CDC guideline or DHHS, whichever is lower, and DHHS is currently following that federal guideline and following the science. In my conversations with DHHS, I have not heard that it is their intent to put it at 0.
Thank you, Madam Chair.
Thank you. All right, I think that's it for those two bills. We're going to move on. Next, I think we have, double check my cheat sheet. I think I'm going to just do the cards all together at the end. So moving on, we will take testimony from the lead sponsor on House Bill 4532, Representative Rachel Hood, and followed by Paul Hahn, Lead Programs Manager for the City of Grand Rapids, and then we'll take questions on Rep. Hood's bill after those two folks. Welcome.
Thank you, Madam Chair. I appreciate your partnership, not just on these bills, but on health policy overall, and especially when it focuses on lead. Lead poisoning, as you know, as has been covered, is persistent and a significant threat to all people in our communities, specifically and especially our young children and their families. From a big picture view, my community in Kent County, the City of Grand Rapids, in partnership with the county's public health offices, has made great progress in reducing childhood lead poisoning by more than 90% since 2001. But the bad news is that the numbers of lead poisoning, the population had started to grow in 2014 and 2015. And now we continue to see hundreds of children in our community who are exposed to lead and diagnosed with lead poisoning. Grand Rapids, in particular, is sadly home to a zip code, 49507, where lead-poisoned children are predominant, and it is the highest number of lead-poisoned children identified in the state. I think Paul can talk to you a little bit more about this, but one of the reasons is because we have a significant program to identify families who are in the midst of housing that could be a threat to their children. And to Rep. Rogers' point, when we see more consistent blood lead level testing, especially with younger children, infancy, up to 2-3 years, we see those numbers go up. And I agree with Rep. Rogers that with the passing of the Cherry bill, that we likely will continue to see these numbers increase rather than decrease in the near term. And that is why beginning to codify this legislation and other pieces of legislation becomes critical, because we know that these children are obviously very important to their families and to our communities and worth our investment in protection. We also know that when children are not protected from lead, we bear significant costs in our K through 12 systems for early childhood development interventions, significant costs throughout their K-12 experience, and lots of studies have pointed to the intersection between criminology and lead poisoning. So we continue to pay for, for the failure to address lead poisoning throughout an entire lifetime. Despite our best efforts, people of all ages can be exposed to lead from various sources. And there's a lot of confusion because of the prominence of the discussion around lead in water coming out of Flint. There continues to be a lot of confusion and misalignment of our responses when, in fact, more children, significantly more children, are poisoned as a result of lead dust in their homes than are poisoned as a result of exposure to lead through water systems. So we've done a lot of really wonderful work. Thank you to all of you who have championed those causes around lead and water, but now it's time to take on the real issue, or a similarly or more significantly important issue, which is the lead dust issue. And the renovation and repair rules seek to accomplish that. I mentioned that we are still poisoning children in Kent County. In 2019. Data indicated that 222 children under the age of 6 were identified with elevated lead levels in Kent County. And again, I mentioned that these levels are likely undercounted due to participation being limited to Medicaid and the Special Supplemental Nutrition Program, as well as other factors. And those numbers, decline further when we overlay the impacts of COVID and lack of access to appropriate care for our 0 to 5 kids. MDHHS and other institutions have made excellent strides to reduce this exposure, but we continue to see the problem. House Bill 4532 in the lead remediation package provides changes required by the EPA, the US EPA, to continue authorization for the lead abatement and pre-renovation education programs. This will ensure continued funding from the EPA for Michigan's lead programs. It will also require Michigan to be one of the 14 states to enforce the renovation and repair painting rules, which is, again, part of the federal lead regulation that requires building contractors to be certified for lead-safe work when working in older homes built before 1978. Any renovation and repair or painting project in a pre-1978 home or building can easily create dangerous lead dust. EPA requires that the renovation and repair projects that distribute lead-based paint in homes, childcare facilities, EPA requires that renovation and repair projects that disturb lead-based paint in homes, childcare facilities, and preschools built before 1978 be performed by lead-safe contractors. Generally, EPA's lead renovation and repair rule does not apply to homeowners doing renovation and repair projects in their homes. And so there's an additional need that MDHHS addresses to educate homeowners. 70% of Michigan homes and buildings were built before 1978, making this enforcement crucial for public health. With hundreds of millions of federal dollars appropriated by the state for weatherization and energy efficiency upgrades in low and middle income family homes, it's vital that we update these standards sooner rather than later so that all of those federal dollars going into repair align with renovation and repair rules and standards. And without that, we may actually be part of the problem. Contractors use a wide variety of methods, and each job is unique. As a result, the additional costs of renovation and repair ranges. the EPA has done some very sophisticated analysis, and they reference the average absolute cost to comply with the rules from $35 to $376, depending on the size and the nature of the job. The average incremental cost of complying with the rule ranges from $8 to $124. And again, when we compare that cost to the cost of dealing with the developmental delays or the health issues, this is a bargain, right? But the reality is that certified contractors are already working under these rules. They are already making sure that they and their staff are certified. And so many upstanding businesses are already incurring these costs, managing to, move projects forward and do responsible repair and renovations. But making sure that we are codifying this and reflecting this in Michigan law and being consistent is critical. To the point that our friend from DLED in Detroit makes, there are still many people in this industry who are not integrating these best practices into their work. So with that, I'd like to introduce lead paint program specialist from the city of Grand Rapids, Paul Hahn. He is a constituent, and I've worked with him for, 25 plus years on this issue and more broadly on community development as well. I'm very eager to hear from him. I'll toss it over.
Thank you. I'm just going to interject a second and say we will have questions right after Paul. I know some other members have questions specifically to Representative Hood's bill. Paul, welcome to Health Policy. Thank you for joining us.
Thank you for the opportunity. Can you hear me okay?
Yes, we can.
Okay, great. I always like to check that, make sure we're not just talking into space. I appreciate the testimony that went before because it really sets the playing field for my comments today. We are concerned about lead in children's bodies, but we have to ask ourselves how it gets there. And as Ms. Henry mentioned, it's in the environment, in these homes. And as others mentioned, no lead in children's body is good. If we ask ourselves, how does it get into homes? The answer to that question is that it was put there with lead-based paint, as well as in plumbing components, but primarily in lead-based paint many, many years ago, and that paint is deteriorating. It needs to be maintained in order to keep the home safe. If it's not maintained, the home becomes unsafe. And if unsafe work practices are used, that lead is released into the environment. So it really is about maintenance and the use of safe work practices that gets out in front of this problem and keeps the lead levels in our children's bodies as close to zero as we want them to be. So thank you, Representative Rogers and members of the committee for the opportunity to provide this testimony. The city of Grand Rapids is in support of House Bill 4532, which revises the Lead Abatement Act. The Michigan Public Health Code assigns responsibility for local public health specifically to counties. However, cities play an important role as voluntary and willing partners in health promotion. And this is nowhere more evident than in the reduction of childhood lead exposure. Combating lead exposure in children has been a priority for the city of Grand Rapids for more than 20 years. And combating lead has been incorporated into our city's strategic plan and included in the city's legislative priority agenda. The current city strategic plan prioritizes controlling lead-based paint hazards in housing to reduce the percentage of children with elevated blood lead levels. The plan also prioritizes the replace of lead service lines in the water distribution system. It's important to work on all fronts. To date, the city of Grand Rapids, without the need for state intervention, has comprehensively addressed lead-based paint hazards in more than 1,875 homes and has replaced nearly 5,600 lead service lines just in the last few years alone. As written, this bill will bring the administration of the Federal Renovation, Repair, and Painting Program, commonly known as RRP, to the local level. This will allow the state of Michigan to ensure that this federal regulation is implemented in a manner that makes the most sense for Michigan communities and for Michigan businesses. Requirements in this bill for contractors and rental property owners are already federal law. It's already a requirement. As again, Ms. Henry testified, we're already supposed to be doing this. Unfortunately, people don't know. As a result of it already being federal law, for those that are in compliance with that federal law, there's no additional cost. This does not add cost to doing work in Michigan for those who comply with federal regulation. The value of this bill is the cost savings and health protection for Michiganders, especially Michigan's children. The Health Impact Project, an initiative of the Robert Wood Johnson Foundation and Pew Charitable Trusts, working with Ann Arbor's own Altarum Institute, forecasts that gaining compliance with this federal RRP rule is the single most cost-effective way to protect children from lead exposure, the single most cost-effective way. They report a return of $3.10 on every dollar spent following lead-safe work practices. In a state with abundance of older housing, this Representative Hood mentioned 70% of our housing. Nothing is more critical than maintaining that housing and making sure that the renovation work we do is informed. We don't want to turn intact lead-based paint into hazardous ingestible lead dust. A recent study of 345 homes in Michigan clearly demonstrates that lead dust on the floors and windowsills of children's homes is the greatest predictor of elevated levels of lead in the blood. That lead does not come from intact paint. It is found when paint is allowed to deteriorate, and unfortunately when unsafe work practices are used in the repair, remodeling, and renovation of older housing. This bill is innovative because it looks beyond the limitations of an abatement-only approach. To date in Michigan, we've really focused on abating lead hazards in housing, and that's really, really important. However, abatement's not the only solution. We also need to be maintaining housing that is lead safe. As the Health Impact Project demonstrates, there's a far more cost-effective solution than expensive abatement projects, and that is maintenance and safe work practices. To get serious about protecting children from lead, Michigan needs to prioritize maintenance. It needs to prioritize maintenance of the state's aging housing stock and the expansion of lead-safe work practices. House Bill 4532 does exactly that. It prioritizes the teaching, support, and use of lead-safe work practices in Michigan, bringing the administration of this federal rule that already exists to Michigan assures that the rule is designed and implemented in ways that is right for Michigan contractors, for Michigan property owners, for our communities, and for our children. An abatement-only approach, which is the only approach currently allowed by the state's Lead Abatement Act as it's written today, is a costly strategy that is severely limited by a statewide, I'll even say national shortage of trained and certified lead abatement labor. This bill intervenes by preventing lead hazards from being created in the first place, and it also enlists a much wider labor pool of ordinary contractors and rental property owners as active participants. It promotes sound property maintenance practices using safe work practices to prevent lead exposure. So the City of Grand Rapids enthusiastically supports this passage of this bill. It affords the state the opportunity to engage many more people and business sectors in the prevention of lead exposure. And it also positions the state to work cooperatively and proactively with local communities like Grand Rapids and elsewhere to explore additional property maintenance and safe work practice strategies. Local communities can be very, very strong allies in combating lead exposure. Indeed, much of the work to help children heal, as Ms. Nickert said, reflected on, happens at the local level. We provide them with safe living environments, we ensure safe housing, and that happens at the local level. Cities and counties are eager to help. Here are two specific ways the City of Grand Rapids is already helping. Since 2005, the City of Grand Rapids has required in its property maintenance code prohibitions on the presence of peeling and chipping paint, prohibitions on paint chips and residue in housing, and prohibition of bare soil around the housing. Code enforcement is a valuable strategy for ensuring that lead-based paint does not go unmaintained and get into the condition that it poisons children. Furthermore, City Code references that federal lead safe work practice standard and requires that those doing renovation and repair in older housing follow the practices of this bill. And that work, the city does not assume the enforcement responsibility for that bill. We simply echo it and we work in partnership with our partners at the federal level to ensure that those practices are happening. Bringing that to the state of Michigan would be very, very helpful. Also, in the past 18 months alone, the city has trained 232 contractors, rental property owners, and others in lead safe work practices. The industry is hungry to learn about these practices. Rental property owners, contractors want to be a part of this solution. And so when we offer free classes, they fill up. We're known for filling those classes. And so with a couple hundred more people trained, we have much more work to do, but we have a good head of steam. And we're very thankful for our partners at the EPA and our local partners at the Rental Property Owners Association and Home Repair Services for helping us do that education. So it's through efforts like House Bill 4532 that supports this kind of local initiative. And the City of Grand Rapids is committed to working with the bill sponsor, members of the committee, the Michigan Department of Health and Human Services, and others to ensure that this bill achieves the highest level of safety for Michigan's children, while also protecting business interests of contractors and property owners. We understand those costs. We understand that we need to do both of those things. To help us protect children by promoting ongoing property maintenance, using safe work practices, we encourage your support of this bill. Thank you for the opportunity to speak, and I'd be happy to answer any questions.
Thank you so much, Paul, for your testimony. We appreciate it. I've got Representative Filler and then Glanville with questions, and then we do have one last person to testify in opposition. Representative Filler.
Yeah, there was a mention of, I have two questions if I can get them in quickly. Federal funding that we're losing. Representative, is there some discussion about what that federal funding is and how much it is? That's my first question.
Representative Hood, do you want to try taking that? Or?
I'll need to research and get back to you. I'm happy to respond.
Thank you.
All right, thank you so much. And then I'm really interested, so I guess judging from the testimony, it sounds like your take is that we're just not doing enough training to the federal level for people who are doing renovation work in Michigan. So if this bill does become law, what does it actually look like on the ground floor for people getting additional training, additional certification, and how heavy is that burden going to be on people who step up and are going to do this renovation work?
I defer to Paul if he's available to answer that question, as he has more direct experience managing or participating in the education program.
Paul, would you like to speak to that?
Yeah, I think there's been a great deal of support from the federal government, from local communities, and from partners to try to make that access to that training as affordable as possible. We know that that's a barrier, and that is something that we want to strive to continue to remove. Yeah, the other part that is important to understand is that enforcement currently through the US EPA is out of the Region 5 field office in Chicago. And a lot of the monitoring is done through desk audits and things of that nature. And that's really important and helpful. The challenge that our local code enforcement folks have is when they receive a complaint, the expectation of the public is that somebody will come and take a look. And that's very difficult to achieve when most of this work is being done out of Chicago.
Thank you. Representative Glanville.
Thank you, Madam Chair, and thank you to all of our presenters today. This is a very important topic. I am also from the Grand Rapids area, so appreciate the history and the issues that we've dealt with there. One thing I wanted to ask about was just some clarification on the fines and citations that are included with the bill. And so I just have two quick questions about that. In one section, as I understand it, it seems as though the fines are being raised. I got that. But then it also, as I'm interpreting it, it looks like it says that they will be assessed per violation and then per each day that a violation continues. So for a first offense, it's $5,000. And I'm just wondering if I were to be notified of an offense and fined $5,000 every single day until I fix it. That seems, I don't know if I'm misinterpreting that. That just sounds a little.
Rep. Hood, could you explain how that would work?
Well, I think Paul's point and the experience that Teresa shared indicate to you that it's quite difficult to get a fine in the first place. And then if you were cited, by a regulatory entity and continued forward, as was the case in Detroit and Teresa's experience, then you would continue to have increased fines.
So just so I understand, if you were to stop the project, that would, if they stopped working and start, so that they could switch course, that would mitigate, that would end the fine.
Yes, ma'am.
Okay.
Yeah.
And then the second clarification I was looking for, kind of a similar thing, as I understand it as well, currently, if there's a fine levied or a citation, if that, let me see if I can word this. I'm trying to twist it around so I can word a question. But as I understand it, now if somebody is in violation, they may receive a citation either within 6 months. So there's a 6-month window for that citation to be processed or handed over. But it looks like the bill is changing that 6-month window to a 5-year window. So as I'm reading this, it sounds like somebody could be reported for a violation, and then they might not receive a citation for up to 5 years, which again, to your point, if there's a violation, shouldn't they be cited and immediate as soon as possible?
Well, it would certainly be my intent to make sure that the violation would be interrupted and that the activity would cease. I think it leaves the window open for the actual citation to be administered.
Okay, yeah, I just was wanted to make sure I was reading that correctly.
Thank you.
Thank you.
Thank you. Next up, we're going to have Erica Farley, representing the Rental Property Owners Association of Michigan, testify. Welcome to Health Policy. Begin whenever you're ready.
Thank you. And thank you to the committee members for letting me, I know I got to get close to these mics, for letting me testify today. My name is Erica Farley, and I am the executive director for the Rental Property Owners Association of Michigan and also for Kent County. And I've worked closely with Paul and with the city on a lot of the things that they are doing regarding a lead dust test ordinance that we've been working on over the last several months. I am here to testify on House Bill 4532. I want to make it clear that the RPOA, both for the state and for Kent County, is obviously not opposed to lead testing and ensuring that we have safe and clean housing for all of Michigan's residents and for those who are in rental properties. That's one of our main goals as an association, is to make sure that happens. Our concerns with 4532 specifically have to do with a couple specifics in the bill. One of the things that the representative brought up was the 5 years, allowing 5 years from the time of the violation for that to be brought forward. It's going from 180 days to 5 years. That seems like kind of a huge jump in our estimation. In hopes that if there is an issue, that yes, we would want that noted and taken care of immediately, as opposed to waiting that long. The other thing that we had, one of the concerns that we had talked about, that I was looking for a definition in the bill, was a dust sampling technician, and what exactly the definition of that was. I understand the some of the training that is specified within the bill, but not finding specifically what a definition of that is, and that may relate to something that the City of Grand Rapids is looking to do with the ordinance that they have delayed for 90 days because it is not in compliance with our state inspection laws at this point. So we had some concerns about that. So as we look through the bill, this is not about not wanting lead dust testing. This is not about wanting to make sure that children are safe throughout the state of Michigan. This is about making sure that what we do here is actually viable. And then the other thing regarding the RRP testing, as opposed to some other things with lead dust swipes, two things. One is 3M is the one who has been producing those lead dust swipes, those white. 3M is no longer making those, and there's only one other vendor in the United States who is making those, and it is unclear as of within the last 60 days who would actually be supplying those here in the state of Michigan, and we're not sure what that looks like and what the remedy for that is at this point, since 3M is no longer making them. And then the other thing, because RPOA members, the majority of them are single-family residents, and the majority of our members are maybe 1 to 5 properties. We are not large management companies. These are people who are using this as retirement funds. They have inherited from family members, and the RRP test itself can range from $600 to $750 per house, per residence, and that does not include the inspection fee. So we will also, because we're having a shortage here in Michigan, we obviously know about housing. Misha is saying 190,000. Some people are saying more than 190,000, wanting to make sure that those properties are still able to be maintained and lived in without trying to take people out of the industry and taking those homes away from people who desperately need them. So these are some of the concerns that both the state and the county association, there it is, have regarding the bill, but we are definitely looking forward to working with the sponsor and with the chair and trying to clarify some of these issues. I'm happy to answer any questions anyone has any.
Thank you so much. Minority Vice Chair Vanderwall had a question, I think, for Paul.
Well, actually,
go ahead.
it works for either one.
Okay.
Thank you, Madam Chair, and thank you for being here. Part of my question was asked by Rep. Glanville on the fines and what that potentially could do if they started a project, they weren't completing it as quickly as possible. Would that mean the project needs to be shut down and the people exit the home? The other part of it is we have a stressed market. We already have a shortage of contractors. And my concern is under this bill, it potentially tells me that by the fines and whatever, we're going to have to ask people to evacuate or to leave their home and find other residents during a period of time in an already stressed market. That is what I believe your testimony is. If Paul could answer directly to that question, but that's concerning that we would put people out of their homes while we're trying to complete a project.
So this is a question that we have been looking for an answer on, which is what happens to those residents if they need to be removed from the homes. One, where are we going to place them? And two, who is responsible for paying for that new placement? And really haven't been able to get a very clear answer on that. We would love to continue to work on that and find that answer, but we also want to make sure in the process, and also what does that mean? And how many rooms, what does that remediation look like? What part of the homes are we looking at? Things along those lines to try to make sure that people are staying in their homes, because one of the things our membership talks about, and I talk about a lot, is even though for the people that I represent are the property owners and the homeowners, these are the residents' homes. This is where they live. This is where they raise their children. This is not interchangeable in and out at any time. We have property owners who have people who've been in their homes for 20, 30, 40 years, and this is where they live. Now, it is the owner's responsibility to make sure that they are safe, that they are livable, that they are clean, they are maintained. There's absolutely no question about that. But we also want to make sure, as none of us in this room want to be removed from our homes, if there's a way for that to be taken care of. And if so, then again, who's taking care of that? Who's paying for that? Is that the property owner's responsibility along with the testing? Maybe there's an answer that I just haven't gotten yet.
Rep. Hood, did you want to chime in?
Yeah, I don't intend to stoke fear about displacement, but I have a couple of comments. One is that I personally renovated a home with my children in it, 100-year-old home. Paul was critical in helping my family understand how to do renovation and repair on our own. During the period when my very young children, at that time between 0 and 3, were in the house, we were able to successfully do what we needed to do to both contain the lead on the property and prevent further exposure without significant displacement. There were moments where I had to take the kids to the Children's Museum while, Dad did some sanding. But thank God we knew. And I would hope any contractor working in a home with children present would be fully trained as a result of this law to be able to intervene and make sure that the children were protected in that home. There will be circumstances, and we've had discussions in the city of Grand Rapids about this, and Paul can speak to it. I'm sure he helped to mitigate displacement in several situations while he was at the Healthy Homes Coalition. But responsible practices are critical here in order to protect children. And the cost of dealing with an IEP can be $40,000 a year for 12 years. There is just no replacing a healthy brain and a healthy nervous system.
We are almost out of time. Did you want Paul to chime in?
Yeah,
Paul,
please.
you have about 1 minute to chime in real quick on the question.
Yeah, I'll just add, this bill, Michigan Lead Abatement Act also regulates the abatement industry. So some of those extensions in time and the dollar amounts on the fines are really calibrated towards that enforcement activity around the abatement industry. In this space of renovation, we are talking about safe work practices. So yes, stopping the work practice that's unsafe is the start of remediating and solving the problem. I think it's really important that we also, at some point in time, hear from folks who have been certified and trained in this area, and the impact that has had upon their businesses. I think you will learn quickly that there are very common sense ways to go about doing this work that ensure that children are protected and that we don't pay the price of that exposure.
Thank you.
No family wants a hazard in their home.
Thank you so much. We do have some cards to read in. I'm going to do a few, and the rest will be read into the record. I will say, I think, as indicated, Rental Property Owners Association of Michigan does oppose HB 4532 as written. Michigan Nurses Association supports all three bills. Association of Builders and Contractors opposes 4532. MHA supports 5368. Michigan Association of Health Plans supports 5369. MSMS supports 5368 and 69. Ecology Center supports all three bills. Michigan Academy of PAs supports all three bills. Wayne State University supports all three bills. Parents for Healthy Homes supports all three bills. National Wildlife Federation supports all three bills. ARC of Michigan supports all three bills. Michigan Environmental Council supports all three bills. Upper Peninsula Environmental Coalition supports all three bills. Michigan League of Conservation Voters supports all three bills. And Sierra Club supports all three bills, as well as Michigan Association for Local Public Health supports all three bills. And Michigan Council for Maternal Health Child Health supports all three bills. The rest will be read into the record. It is my intent to take these bills up for a vote at the next meeting. Representative Hadsma moves to excuse Vice Chair Whitsett. There being no objection, motion prevails with unanimous consent. There being no further business before the committee will stand adjourned.